Well, good afternoon or good morning, everybody, depending on your time zone. This is Mike Fraser speaking. I am the Executive Director of the Association of State and Territorial Health Officials, and I'm really pleased to welcome you all to a webinar today as part of ASTHO's observation of National Public Health Week. And for those of you who are not as familiar with ASTHO as others, ASTHO is the national organization that works with state and territorial health leaders nationwide to advance the nation's health. We partner with state and territorial health officials, and today's presentation is a wonderful opportunity to get to know one of our states a lot better, the state of Montana. And I'm really pleased to make this introduction to you in a moment of some state health leaders from Montana and to talk about an issue that this last season, and which is continuing, influenza, has been with us for over 100 years longer, and having the opportunity to recognize the 100th anniversary of the Spanish influenza and think through its history and then what that all means both for contemporary public health practice as well as the past is really important. The 1918 influenza pandemic has been recognized as the most devastating infectious disease disease event ever recorded in history, and caused over 50 million deaths worldwide. And so paying some attention to that this year on the 100th anniversary of that makes a lot of sense for health officials who are committed nationwide to preparing for and mitigating across all serious infectious disease threats, including flu, and we got a taste of that again this flu season. So it's important that ASTHO, ASTHO wanted to recognize this 100th anniversary along with our Public Health Week, and again, paint a picture for what that outbreak was like, given some historical research, and then have a conversation about that research and what that all means for the future. So today's webcast will showcase perspectives from Montana's State Medical Officer, Greg Holzman, and Todd Harwell, who's Administrator for the Public Health and Safety Division at the Montana Department of Public Health and Human Services. They're going to share some of their work on pandemic flu and Spanish influenza in Montana and the pandemic's impact on the health of Montanans. And when I was out in Montana earlier this year, I guess it was back in January, Greg and Todd shared with me a copy of their research and the contents of the article that they were preparing, the manuscript they were preparing for Montana, the magazine of Western history. And it was really a fascinating piece of work, and to weave together the stories from 100 years ago and really think about what that state was like then, and get some of the nuance, some of the social nuance, as well as the epidemiology and more of the traditional public health side of things was really cool. And I think y'all will really enjoy some of the learning, which was really expertly compiled and really affected everybody in Montana, both housewives and farmers and miners and railroad men and other laborers, and remember, soldiers, because this was the time of World War I, and obviously folks working in medicine and public health. So let me introduce you to our presenters today, and then turn it over to them to share some slides. And for those of you who are just listening to the audio, there is a video component if you'd like to see the slides, but certainly you'll get a great story as well by just listening to the audio. Dr. Greg Holzman is the State Medical Officer with the Montana Department of Public Health and Human Services. They're headquartered in Helena. And some of Dr. Holzman's previous positions have included Director of the Healthy Campus Initiative at Michigan State University, as well as serving as Associate Chair of Preventive Medicine within the Department of Family Medicine at Michigan State University, and the Chief Medical Executive for the Michigan Department of Community Health for the state of Michigan. He was also Deputy Director for the Office of State, Tribal, Local, and Territorial Support at the Centers for Disease Control and Prevention. And over the course of his career, Dr. Holzman has worked on a number of public health policy issues ranging from smoke-free legislation to funding for a statewide trauma system. He has a special interest in social determinants of health, health promotion, and disease prevention, the elimination of health disparities, and building better integration between clinical medicine, public health, and community-based organizations. And as we will learn, is a history aficionado as well, and a wonderful, can tell a wonderful story about this particular case. Mr. Todd Harwell is the administrator for the Public Health and Safety Division within the Montana Department of Public Health and Human Services, and that includes many different program areas such as epidemiology and disease control, public health emergency preparedness, environmental health, family health, and laboratory services. Todd has been working in public health for nearly 3 decades, principally in the area of chronic disease prevention and health promotion, and has also held academic appointments in the departments of community and preventive medicine at medical institutions both in North Dakota and Pennsylvania. He served as an expert reviewer for a number of professional journals and has contributed to over 80 peer-reviewed professional publications throughout his career in public health. So 2 very well-qualified and very interesting individuals who are part of our ASLO family, and I really want to thank them for sharing this work with us. It's fascinating, and I think will be a great way to reflect on 100 years ago as part of our National Public Health Week events. So let me turn it over to Dr. Greg Holzman without any further ado. Greg, the floor is yours.
Great. Thank you, Mike. All right. Well, let's get started. As was said, my name is Greg Holzman, and I'm here with Todd Harwell, and we're speaking to you from Cogswell Building in Helena, Montana. You will learn a little bit more about Dr. Cogswell in the presentation to come. However, before Todd starts on this presentation, No More War, No More Plague, the Spanish influenza pandemic toll on Montana, let me try to set the stage for you all. It is the spring of 1918. There's no 24/7 news, no Sanjay Gupta, no Dr. Besser, and no CDC. The Great War is raging in Europe. Fear of immigration, xenophobia, is at a heightened state, especially towards those who are German, Austrian-Hungary, and even Irish descent. The Irish were not members of the Central Power, the U.S. enemies, but they did not support the U.S. ally Britain, and thus the Irish did not uniformly support the Allied powers' war effort. The women's suffrage movement was moving forward, as was prohibition. Labor disputes were occurring. Unions and union busters, the working man versus the elite, were in constant power struggles in the courts and at times violently on the streets. Medicine was also changing. While epidemics and outbreaks were well known throughout time, the evolving concept of the germ theory added to the slightly more established sanitation theories were changing society's understanding that disease could be prevented. Public health was growing and gaining respect in communities and states across the nation. Physician training and the science of medicine supported public health advances, and the standardization was happening, especially in medical education, due to the Flexner Report. Medicine and public health were beginning to be seen as a science. Montana, the state that had the 3rd highest mortality rate secondary to the 1918-1919 influenza pandemic, was really a microcosm of all that was happening. Women had already won the right to vote in Montana in 1914, although suffrage for Native American women and men had not been codified. In 1916, Montana sent the first woman ever to the U.S. House, Janet Rankin, a woman who was known for her opposition to war and who, at this time, is running for the U.S. Senate in 1918. Prohibition had already passed in Montana and was set to go into effect on December 31st, 1918. Saloons had only a little more time to sell their alcohol, at least legally. Due to the abundance of metals in the Montana mountains, mining, and all that went along with it, stamp mills, reduction work, smelters, etc. were booming. The opportunity for work brought immigrants from far and wide to the Treasure State, Montana. The city where many ethnic groups were represented was Butte, Montana, in the county called Silverbow. Butte was known in 1918 as the richest hill on earth. In Butte, unions and union busters often clashed. This could also get mixed up into issues of ethnicity, religion, and supporters and distractors of the war effort. Class status was readily and at times bitterly invoked. Views of the war could also be tied up in class issues. For Butte labor leader Frank Little, who later died in a lynching, World War I was a rich man's war and a poor man's fight. As highlighted previously, xenophobia was present in Montana, and with many Montanans vocal against the war, including the U.S. Congresswoman, politics and politicians got very involved. The Montana legislature met in a special session in February 1918 and passed the Montana Sedition Laws, an act that made it illegal to criticize the government, the armed forces, and other entities. This law became the model of the U.S. sedition laws that were passed later that year by the federal government. Years later, these laws have been seen as a major abuse of our liberties. By the way, the Montana legislature also passed a gun registration law to allow local authorities to be aware of where the guns were. You had to register your guns. So welcome to 1918 Montana, a state that is only 29 years old, with the state public health department just 17 years old. Just as a side note, the Montana legislature passed a bill in 1901 to develop the first Montana Board of Health and the start of the recognized public health at the state level. The bill passed in March of 1901. By April, the first Board of Health meeting occurred with both the governor and attorney general noted as ex officio members of the board. A state in the wild frontier is trying to address all the important issues of the day that we just talked about. Now it is about to be confronted with but not one other major issue, the great influenza. And with that, I'll hand the mic over to my colleague, Todd Harwell.
Thanks, Greg. And Greg and I just want to thank ASTO for the invitation to present today. And also, it's National Public Health Week, but just wanted to thank and recognize all the staff from ASTO for all the work you guys do on a day-to-day basis to help support public health here, both state and territorial public health. We really appreciate it. So the disease influenza, it's been recognized for centuries, but the influenza that came in 1918 was no ordinary influenza. And I'd like to start with a quote from John Barry's book, The Great Influenza. Nature chose to rage in 1918, and it chose the form of the influenza virus in which to do it. This meant that nature first crept upon the world in familiar, almost comic form. It came in masquerade, then it pulled down its mask and showed its fleshless bone. So the Spanish influenza epidemic of 1918-1919 has been mentioned was the most devastating pandemic of the 20th century. Later in the decade, or later in the 1900s, it would be identified that the causative agent was influenza A, H1N1. And as Michael mentioned, over a third of the world's population were infected, and there were over 50 million deaths. Here in the United States, there are over at least approximately 675,000 deaths in the U.S., and about 550,000 of those deaths were excess deaths, meaning deaths that would not have occurred in a normal influenza year. The other really hallmark of the pandemic was its severity and its impact on young adults, which we'll share with you in just a little bit in terms of the impact on Montana. And as Greg mentioned, the pandemic really did occur in not an ordinary time. On this slide, you'll see two images. On the left is a October 24th, 1917 photograph of a military parade here in downtown Helena, Montana. It's the 163rd Infantry, and they're getting ready to leave for the war in France. The poster on the right is a U.S. military recruitment poster basically promoting people, Montanans and Americans, to enlist. So the U.S. entered the war in 1917, and the draft began in June of that year, and many Montanans were eagerly enlisted. And as Greg mentioned previously, the patriotism in Montana and America was intense, and the xenophobia associated with that patriotism was zealous. In addition to all the changes with the war and all the other social issues going on, there was a massive shortage of physicians and nurses in the United States because of the war effort, and particularly here in Montana, where we already started prior to the war with a shortage of physicians and nurses. Just to give you a flavor of what was going on, this slide has a headline from our local newspaper from March 24th, 1918, and it basically says, your neighbor, your maid, your lawyer, your waiter, all may be German spies. And if you can see the cartoons there, it just gives examples of who those German spies could be, everybody from an agitator, a dynamiter, and a germ spreader. The image below that is a photograph from Lewistown, Montana. It's from March 27th, 1918, and it's a crowd in downtown Lewis, Montana, burning German textbooks, both from the library as well as from the schools. So you kind of get a sense of both the paranoia and the xenophobia happening at this time. Montana was going through a significant population change during this time period. Its population grew from 300,000 to almost double, over 550,000 in 1920. And many of those new Montanans were coming here because of the Homestead Act, many of whom were new immigrants to the United States, being Irish, German, Finns, Italians, and other folks from Europe. And as Greg mentioned, not all Montanans were willing to be like waving the flag to support the war against Germany or in alliance with Great Britain. As Dr. Holzman also mentioned, our governor called a special session in 1918 to pass the Sedition Act, and Montana was one of the first states to do that. And that law was used to charge, convict, and imprison people up to 20 years for saying anything against the war, against the flag, or against the government or President Wilson. So definitely not ordinary times. This slide just has a few images of the other war that was going on here in Montana. It was the war between the workers and labor and between the capitalists. On the right-hand side of this slide is a photograph of the richest hill on earth. It's Butte, America. And on the left, upper left, is a photograph of Frank Little. He was a labor leader with the International Workers of the World, or what was then called the Wobblies. And as Greg mentioned, he was kidnapped and lynched in Butte in August of 1917. And the image on the bottom left is a photograph of the first female congressman in the United States, Congressman Rankin. So back in 1918, what was medicine and public health dealing with? So our review from the historic records here in Montana is, and it's probably the same for the rest of the United States, public health was dealing with many communicable diseases, everything from smallpox, measles, tuberculosis, and scarlet fever. Just to give you an example of the burden, in 1918, even when reporting of disease cases wasn't great, there were over 15,000 reportable diseases reported to the State Board of Health. So they were super busy. Medicine and public health at this time were ill-prepared for the massive epidemic that was coming. And also, influenza was just a normal thing. It was called grip back then, but it would come and go, and it was just influenza. And in 1918, the cause wasn't known. There was no vaccine or treatment, and no antibiotics for the pneumonias. In bad seasons like what we've just experienced in the United States here, many people would become ill, but in general, few would die. And of those who would die, mostly it was the very young and the very old. And just to put it into context of how important was influenza at this time in Montana, it wasn't even a reportable condition at this time. So on this slide, I just want to walk through a few things. What do we know about the origin and the spread of the Spanish influenza pandemic in the United States? So we do know the pandemic spread in 3 waves. The first wave is in the spring of 1918. Generally, it was characterized by outbreaks across the United States, many people ill, but there was only moderate mortality. The next 2 waves, the fall wave that hit in the fall of 1918 and in the spring of 1919, was the more lethal wave where many people were infected and there were many deaths. Just a few historic notes we wanted to share with you. An astute clinician, Dr. Loring Miner from Haskell County, Kansas, noticed something was going wrong in his community in February of 1918. He saw a number of influenza cases with very severe pneumonias and deaths. He was so concerned about it, he reported it to the U.S. Public Health Service, which published this one-sentence note in the April 5th, 1918 Public Health Weekly Reports, which is basically like today's CDC, MMWR. It's believed potentially that outbreak spread to a local military camp, which is a photograph that's below that. Many soldiers became ill and died because of that. And then from there, in the spring of 1918, there were sporadic outbreaks across the United States in military camps, some institutions like San Quentin Prison, and in some cities. But by the summer of 1918, the disease was mostly abated in the U.S., but things were brewing in Europe and elsewhere. So one of the questions we looked at was there a first wave event here in Montana? And I think we've come to the conclusion that at least in one town, yes. So these newspaper stories on this slide are of an outbreak of influenza and pneumonia in Butte, Montana, in the last weeks of March 1918. If you look at the first story on the left, basically it's indicating that 20% of the population is ill. The story in the center, which is from the Butte Miner, a local newspaper there, talked about how severe the issue was. Pneumonia is claiming many, Deadly disease follows epidemic of La Grippe, which swept over the city last week. Many victims are called. And if you can see at the bottom of that newspaper article, they're hoping that it's going to have showers coming so it can clean the filth and the germs that have accumulated over the past winter. Businesses in Butte were severely impacted, and we saw a number of newspaper stories back then of one in particular where over 1,400 miners in Butte were off from work because they were all ill. And if you look at the newspaper clipping on the right-hand side of the slide, even Lieutenant Governor McDowell, who traveled down from Helena to Butte to do some business, he even came down with a severe case of influenza. So on this slide, this photograph is U.S. Surgeon General Rupert Blue. Dr. Blue was in charge of the U.S. Public Health Service at the time. And one question we tried to look at here was, was America aware and prepared for what's coming? So the second lethal wave of the pandemic would hit the United States at the end of August 1918. And unfortunately, it wasn't until August 9th that the U.S. Public Health Service even took notice. There was a press from the Surgeon General indicating that influenza was prevalent in Europe and Hawaii and elsewhere. And then on August 16th, 1918, the Surgeon General sent out alert to quarantine stations to notify the stations to be on alert for ships coming into American ports that had ill passengers and not allow the passengers to leave those ships until the health officers were notified. So the pandemic hit Boston on August 27th, 1918, where the first cases were identified, and the first death in Boston happened on September 8th. So the second deadly wave of the pandemic had begun in the United States. And amazingly, 15 days later, going through the death records here in Montana, 15 days later was the first death among a Montana resident, a 3-year-old child in Browning, Montana. So you may ask, well, why wasn't the U.S. prepared for what was coming? And mostly it looks like it was from the government, because of all the social issues and other issues and because of the war, the government was solely focused on the war effort and not looking backwards at kind of protecting the population here. The first newspaper accounts in Montana of the epidemic came in late September. If you look on the left side of this slide, it's a newspaper clipping here describing the epidemic taking place or outbreaks on the East Coast and many deaths in Boston. The Surgeon General provided recommendations in this recommendations to the public on how to treat and address this issue. His recommendations were go to bed and get rest, get fresh air, have abundant food, and call a physician, which is always great advice. The newspaper story on the right is the first notice in Montana of the outbreak hitting Montana. It's from the far northeastern corner of the state from Glasgow, and it basically noted that there were many cases in rural communities surrounding Glasgow. It also cautioned people to not, indicated that some people in the community were becoming panicky, and it basically said there's nothing mysterious about this germ. It's well recognized, and it's only the complications that result in fatality. There were newspaper articles up in the northeast corner of the state at that time that speculated about how Spanish influenza got into Montana at that point, and one of the hypotheses was cattlemen from northeast Montana were taking their cattle to Chicago to market. They became infected and then brought the flu back to Montana at that time. So just a quick review of what we tried to do here for our project. So there's been a number of outstanding historical studies of Spanish influenza in Montana. But one thing we noticed going through the historic record here was there was no kind of basic epidemiology or of the mortality or the experience of death here in Montana. So over the past year, we reviewed all the death records from 1918 and 1919. And then we also reviewed death records and identified influenza cases for 1928 and 1929 to use that as a comparison period for a non-pandemic season. I won't go through this in detail. This is just the methods we use, but what we're going to show you, I'm sure most of you are familiar, it's basic epi rates calculations and those kind of things. So this is a copy. I hope you can see this. It's a photograph of one of the death certificates from this time period. This gentleman is Mr. Joseph Herman. He was 22 years of age. He died of Spanish influenza on October 27, 1918. He had the influenza for 9 days duration. He was a laborer and a ranch hand. Basically, he moved sheep and cattle in central Montana, and he died in Geraldine, Montana, which is in Choteau County. I'm going to share a little bit more information with you about his story a little bit later in the presentation. I think one other thing, Greg and I recognized as we were going through the death certificates at this time period, it definitely was a Wild West. The Spanish influenza was horrid, but the leading cause of death in Montana during that time was injury and violence. So a lot of crazy things going on with that. And then the other thing that really stuck out to us was the number of children who died in Montana either from vaccine-preventable diseases or antibiotic-preventable diseases. It was pretty impressive. So the first wave of the epidemic, again, just want to give you a framing point, that was the January through June 1918. Montana had relatively few deaths. We had 53 total deaths in that period from influenza. The first death was amazingly among a 103-year-old woman who lived in Carbon County. She actually lived at the Poor Farm in Carbon County, and she died on January 16th. Of those 53 deaths, most were in Silverbow County, which kind of connects back with the first wave events in Silverbow. And one hallmark that came out when we compared the characteristics of those deaths in 1918 compared to the same period in 1928, the mean age of descendants in 1918, they were about 10 years younger, which is, again, it's the hallmark of the Spanish influenza epidemic, killing young adults. So the second wave of the epidemic, or the first death, as I mentioned previously, of the second wave, which started in September of 1918, was a 3-year-old American Indian boy. His name was Woodrow Lazy Boy. It happened on the Blackfeet Indian Reservation on September 23rd. Over the next 2 weeks, there were 7 additional deaths, and there was a small cluster of deaths up in the northeast section of the state. So the tsunami here of the Spanish influenza epidemic had begun in Montana. And over the next 10 months, from September through June of 1919, there'd be over 4,100 total deaths because of the epidemic. So this slide, I'll just walk you through it to orient you to it. It provides influenza death rates during the 2-week time periods from September 1918 through June 1919, and then during the same time period for the comparison, which is 1928 and 29. So if you look at the x-axis on the bottom, 0 is the second to last week of September. 20 is the last week of June. The gray area, the light gray area on this figure is the number of deaths during the non-pandemic year. The black area is the number of deaths during the pandemic year. And as you can see, in early October, November, the number of deaths in Montana soared. And then generally what we saw statewide was a significant decline through the end of November and through December and January and February, and then a small rise again in the number of cases in the spring of 1919. I'm going to share, in some counties in the state, the graph or this figure looked a little different. They had a significant rise in deaths in October and end of October. The death rate or the number of deaths declined in early November, and then they shot up again, and I'll talk a little bit more about that later in the presentation. So this slide shows the influenza death rates by county. And as you can see, the second and third waves of the pandemic did not hit the state equally. The darker blue areas are the areas that have higher mortality rates. Our overall state mortality rate for Montana was 7.7 deaths per thousand, and it ranged from 12.9 deaths per thousand in Silverbow, which is, if you see that little red arrow, that's Silverbow County, to a low of 3.1 deaths per thousand in Sanders County, which is up in the northeast where that green arrow is. One other thing we looked at was we just compared mortality rates in larger population counties to smaller population counties. Basically what we found was larger population counties had higher mortality rates compared to smaller communities. And just to put it in perspective, so if you compare the pandemic to a non-pandemic year, the death rate in Montana was 9-fold higher in the pandemic year compared to the non-pandemic year. And again, the impact on young adults was impressive. 75% of influenza deaths in Montana during the pandemic were among 15 to 44-year-olds compared to only 25% in the non-pandemic period. So this slide just shows the influenza death or mortality rates by age. So the age categories are on the bottom on the x-axis. And just two things I wanted to point out here. The dotted line on the bottom of this figure is the mortality rates for 1928, 1929. And as you can see, it's U-shaped curve. And that's the normal mortality rates you would see in a non-pandemic year, what we would likely see over the past decades. The solid line is the mortality rates for the Spanish influenza epidemic, and it's kind of W-shaped. That's the hallmark of the Spanish influenza epidemic, and you can see that mountain in the middle of that line where the mortality rate among young adults soared. So we also looked at kind of the impact on, a little deeper at the impact on young adults. So there were 3,500 deaths in Montana during the epidemic among folks 18 years of age and older. The majority of those deaths were among housewives, farmers, and ranchers. I think Michael hit on those things. But we had a number, 34 soldiers and 1 sailor died who were stationed here in Montana. 25 physicians and nurses and hospital staff died. And 40 teachers, many of whom were volunteering because schools were closed at this time, they unfortunately got ill and died as well. And then 10% of the deaths among women of childbearing age here were pregnant. So 10% of, there was a large number of women that we know now are at high risk because of pregnancy who died from Spanish influenza. So I want to shift a little bit and talk about some of the stories from the reviews, from the death records, from the newspapers, and also a little bit of digging. We've been able to pull information from Ancestry.com. But, you know, the epidemic, it's similar to other states. It really cut a swath here in Montana, and it had a significant effect on families. So the newspaper story on the left is the notice about the deaths of 3 sisters, the Stallcup sisters, Winnie, Ruth, and Jenny. They were 26, 27, and 32. All 3 of them were teachers down in Twin Bridges, Montana, and all 3 of them died in a two-day period from December 12th to December 13th, 1919. Physicians and nurses, as I mentioned before, they were not spared as well, and many of them likely became infected when they were caring for their patients. So if you look on the right side of the slide, it's a story about Dr. Charles Robert Blake Sr. He was 33 years of age. He moved to Butte, Montana to do his internship at a local hospital, and then he moved to Dillon, Montana to start his medical practice. And the note from the newspaper article kind of hits it on the head. When the present epidemic of Spanish influenza broke out, there were only 4 physicians in the city. In addition to his regular practice, he was answering calls from many of the stricken ones and was on the go almost constantly. The overwork made him easy prey for the disease. Dr. Blake was survived by his 32-year-old wife, Elizabeth, and his 2 children, Elizabeth and Charles Jr., who are 3 and 1 year of age. And interestingly, how these stories tie together, Dr. Blake's wife, Elizabeth, her father was a clergyman in Butte, and I'll tell you a little bit more about him a little bit later, but he was active and angry that Butte had closed down the churches and not allowed services, but they did allow the saloons to remain open during the pandemic. And then the story in the center of this slide really kind of hits it. Many families, both parents were killed by the pandemic, and many children here in Montana were orphaned because of it and basically changed their lives forever. Another thing we wanted to share with you all was just kind of examples of the intersection between the war and the pandemic. And here's just 2 stories from there. So this newspaper story here in the center of the slide is an overview of the death of Corporal Auguste Raphael or Ralph Sauvé. Dr. Sauvé was 29 years of age, and he lived in Saco, Montana, and he was of French-Canadian descent. He enlisted and saw action early in the war in France. He was acting as a French interpreter on the front line. And while he was in service over in France, he was gassed by enemy forces and hospitalized in France. And eventually he got transferred back to Baltimore and was discharged from the military due to his disability. He returned to Montana in early October 1918, and just 2 weeks after his return, as the newspaper story indicates, he took sick from influenza, and since so much of his lungs were destroyed by gas, his chances of living were handicapped from the very first. So here's a gentleman, enlists, travels all the way across the world only to be gassed and come back to Montana and then end up catching influenza and passing away. The second story over here on the right is this is Mr. Joseph Herman, who I showed you his death record earlier. Early in the war, the United States required that all German immigrants who were not citizens, they were required to register as alien enemies, and then they were required to basically carry like a small passport, and they had to register with postmasters to be able to move across districts wherever they were located. Mr. Herman here, again, he was a 22-year-old recent German immigrant to the United States, would carry this passport. This passport was attached to his death record, and unfortunately he caught influenza and died on October 27th. If you look on the right side of this image, you can see the notes from the postmaster giving him permission to go from place to place. So I'd just like to introduce you all to, this is Dr. Cogswell, this photograph. He was our executive officer for the State Board of Health and the longest serving executive officer for the state of Montana from 1912 to 1946. He oversaw the Board of Health here, which worked with local and county health officials to implement public health. One, probably similar to many of your other states, at this time period here in Montana, our local public health workforce, state and local workforce, were very limited, and we had limited resources. And as I mentioned earlier, our state and local public health officials were super busy with other communicable diseases. Our Board of Health, based on kind of the review that we looked at from historic documents, there was no indication they were aware of the early wave of the epidemic in the spring, other than they might have been aware of the pneumonia outbreak in Butte because the lieutenant governor here became ill. The number of deaths in the spring of 1918 were small, so that probably wouldn't have raised flags. There was no warning from the U.S. Public Health Service about what was to come. And the Board of Health, only in hindsight, kind of got a clue when they looked back that they might have had a few alarm bells coming. So the State Board of Health here took a number of actions to try to address the pandemic. They called an emergency meeting on October 9th, and they passed regulations to allow counties and cities to basically close down all public places, isolate ill people, make the disease reportable for the first time ever in Montana, and they also promoted the use of masks, and they, a little bit later in November, worked with the Mayo Clinic to try to get an experimental vaccine here. Between October and December, there were over 37,000 cases reported, but Dr. Cogswell and the Board of Health realized reporting was underestimated and totally inaccurate, and mostly because in many places of the state during the epidemic, the health department completely broke down, and the health officers were too busy dealing with sick and ill and trying to address relief work versus worrying about reporting about influenza. On the right-hand side of this slide, it's just a newspaper article where Dr. Cogswell is pleading to the public to take care of your physicians of the state, conserve their energy and time. Don't call after 10 o'clock. Wait until the morning unless it's an emergency. And it got so bad here because of the lack of health professionals that volunteer teachers and volunteer Red Cross folks would go out, as this image on the bottom shows, and go out into the rural remote communities and just go household to household to check on people to see if they're all right. So the Board of Health quickly realized that the available prevention efforts here in Montana were failing, so they changed their focus to work on relief work. Dr. Cogswell made a plea to the U.S. Public Health Service and the Red Cross to get more doctors and nurses, and we did get a handful of doctors and nurses from out of state. And Dr. Cogswell also appealed to physicians in Montana, if they could be spared from their communities, if they could come and assist in other communities that had no health professionals. The newspaper story in the center is a review of one of those physicians who stood up and volunteered. It's about Dr. Alfred C. Dodge. He left his hometown in western Montana and traveled to Rapelje, which is a remote community in eastern Montana. And when he got there, he basically found that influenza was everywhere. There were over 300 people ill, no doctors or nurses. And he worked with non-ill community members to convert a school and a church into an emergency hospital. And he also worked to identify volunteer nursing aides. And then they, as you can see in the headline of this story, they used a farm wagon as an ambulance to bring people to the emergency facility. If you look at the headline on the right-hand side, things got so bad in Glasgow, Montana, that they put out a plea to any woman who was not ill to please volunteer to help care for people who were sick. And you can see the note about they're giving kudos to the local teachers who are working night and day. But they also called out a number of women in the community. They called them basically slackers, and they put them on the blacklist because they were not volunteering to help people in need. So I'd like to finish up I'll come back to Butte and Silver Bow County because Butte is an interesting place. So during that first weeks of November, the number of reported cases in Butte declined significantly, as well as the number of deaths. And the Silver Bow County Board of Health decided after much debate and also a lot of pressure from business communities and the local politicians that they'd remove the lid on the prohibition of public gatherings. The armistice to end World War I was signed on November 11th, 1918. So peace finally came back. Nice. And there would be no more war. Humanity would stop raging against itself. And as you can see in this photograph, this is an Armistice Day parade in Butte, Montana. So a big public gathering. Unfortunately, in the weeks following that lifting of the lid and the celebration of the end of the war, the number of cases and deaths spiked again. The plague had returned, and nature continued to rage against humanity. And Butte wouldn't see any relief until the end of June 1919, when finally the cases would abate from influenza. So while those number of cases and deaths were rising in Silver Bow County, the Silver Bow County Board of Health decided, again, we need to close down public places and put the lid back on it. The newspaper story here on the left describes a fight between the City Council and the Board of Health. The City Council didn't think the Board of Health had the authority to close down Butte again because it only covered the county, not the city. The Board of Health disagreed, and the Board of Health threatened that they would call the Governor Stewart and declare martial law if the city didn't go along with it. And Dr. Cogswell, as you can see on the right, came down on behalf of the State Board of Health and negotiated a truce on behalf or in favor of the board. So Butte was closed down again. Going through the historic records from the Silver Bow County Board of Health, the Board of Health met every day or twice a day or more between October and December 1918, and they threw everything but the kitchen sink at the epidemic, and it was pretty amazing. I don't have time to kind of go through the list, but they tried everything. I'll go through. Okay. So I'll just give you a few examples of what they tried to do to prevent the epidemic. This was starting on after October 9th. So first thing they did was close down all public places except for saloons. They didn't allow any large funerals. All football games were canceled. Streetcar windows have to be open. Card tables and chairs later in October were removed from saloons, so you could go purchase packaged liquor, but you couldn't have a drink in the bar to reduce congestion. Barbers had to wear masks, and they had to fumigate their barber shops at the end of the day. Undertakers were not allowed to send bodies home for wakes because they didn't want people gathering in those events. The phone company was required to disinfect public telephones. Placards were placed in houses where there were ill people saying flu's here. They asked the drugstores to stay open longer. The streets were flushed versus just being sprinkled because it was believed that dust was helping spread the influenza. On multiple occasions, the National Guard was brought in just to do work on crowd control and try to reduce it. The local junior high was converted to an emergency hospital, and a hospital was established in the local prison because there was an outbreak among prisoners. The board asked the sheriff to begin going around town shutting down saloons who were violating the regulations. And they also tested an experimental vaccine on prisoners, too. The election was happening. The national and local elections were happening at this time, so all public debates were canceled. And on Election Day, they did not allow any posting of election results in public places, again, to just work on reducing public gatherings. And then finally, the military were brought in again. So people in Butte, if you've ever been to Butte, don't follow rules generally. So the military were brought in both to enforce quarantine and work on crowd control. So just to finish, just a couple conclusions from us. So during this time of extraordinary events across the world and in Montana, the most extraordinary deadly epidemic hit the state, and it exacted a dramatic toll. Humanity was raging against itself in Europe, and then nature chose to rage against us here in the United States and across the world, and we weren't prepared, even though the board and the local health did valiant efforts to try to respond to it. There was lots of heroic and inspirational responses, but overall the pandemic pretty much ran its course. And then as a result of this, as you know, some things that happened post-pandemic here in Montana, the next legislative session, the Board of Health obviously recognized they needed an epidemiologist. They didn't have one previously, so they had a plea to get a state epidemiologist. They also requested a law be passed that required that all counties have to have a health officer full-time versus part-time. And then they did a lot of basically emergency preparedness work during the next 1919, 1920, believing that another pandemic was going to come shortly. So a lot of action took place afterwards. And then I'll just end with this quote. This is from the Board of Health in 1920. Our memories of this and other epidemics should not fail. Let's hope that through preparedness and health organization and in the education of new generations, we can prevent a repetition of the terrific losses of which influenza has cost in the past 3 years. So thank you very much. We appreciate it.
Thank you, Todd, and thank you, Greg. That was absolutely fascinating, so comprehensive, and I just loved it. Thank you so much for sharing your research with us. At this point in the program, I'd like to again express my appreciation for our presenters and then open the lines for questions. I know our operator is standing by to queue questions. Do you want to just share the directions on how to do that, please?
Thank you. If you'd like to ask a question, please signal by pressing *1 on your telephone keypad. If you're using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. A voice prompt on the phone line will indicate when your line is open. Please state your name before posing your question. Again, press *1 to ask a question, and we'll pause for just a moment to allow everyone an opportunity to signal.
Great, thanks. Why don't I ask a quick question, and then we'll see if there's any in the queue. Sometimes it's hard when we're all scattered by distance here. But in terms of your research, which was just fantastic, both on the epidemiology and the social history, what was your most surprising finding? What did you think what did you find out you didn't know about?
This is Greg. I guess I knew about it to some extent, but it really just solidified everything and made me think a lot more of if something happened now, that how much else was going on. That, the pandemic was not the issue that was the thing of the day by any means. There are so many other concerns that these individuals had, and they were used to having infections and flu and other things around, but this was just, as Todd uses, no ordinary time. And I think that was one of the biggest interests to me, was everything else that had an effect on this in different ways.
Right. That makes sense. Todd, any surprises from your perspective?
I think the one was the unbelievable heroic efforts with, the State Board of Health and the County Board of Health had virtually no employees. So, and we're working in a massive state. So just the incredible night and day efforts by public health with limited people and limited resources to try to do the best they can with a horrific situation. The other thing that surprised me, or maybe not surprised me, but made me, after we did this work, I grabbed our communicable disease Bureau Chief and Greg and sat down and wanted to get more informed about how prepared are we now, and how, just so I'm aware of what we can do if this happens again.
Yeah, absolutely. That was sort of, I think the thinking about the history, but also the future is really important. Well, let's see if we have any questions from anyone that's listening in, operator.
There are no questions at this time. Once again, if you'd like to ask a question, please press *1.
Great. We'll give that another pause, and I know we're certainly approaching the top of the hour here, so that's just fine. But in terms of man, how things change, but how they stay the same. There was a lot in your presentation, and even just your finding about workforce shortage and working long hours with limited people. Man, that sounds really contemporary. Not unfortunately.
Well, and Mike, I'll just toss in, in some places in Montana, many of our county health departments our rural counties are too deep. It's two people and a 1/10 of a health officer who does standing orders for immunization. So.
Yeah, exactly. In terms of, some of the strategies that were used in history, social distancing was really important. Self-care of physicians was really important. We see a lot of that today, but like public health worker sort of exhaustion and illness seems to be a challenge both then and also now. Did you guys have any thoughts on that and sort of workforce self-care and health of those that help?
I mean, it's a challenge. I think that, you kind of get into it, as I think most of our colleagues will feel the same way. You just kind of start working and trying to get through the day and doing what's important that day. And so I think sometimes when we look back on it, we don't realize all that we've done to ourselves. But the tensions were high, and that I could see that happening easily at this time too. There's a story that Todd didn't talk about that's interesting in the paper about a physician being waved down because of the family this guy wanted him to see his family that was all sick, and he said, "Okay, I'll be right back in a half an hour. I'm going down the street to see somebody else, and I'll stop by." And he pulled out a gun and he said, "No, you're going to see my family now," which he ended up doing. And then later the individual apologized for his actions. But it just, it's besides all the stress and you're trying to work through everything and get what you need to get done, we have a very panicked society who's very concerned too and wants the answers and trying to deal with all that and doing that in the best efficient way. So we're the safest and we're also keeping healthy is always a challenge.
Yeah. Right. Absolutely.
And pardon the interruption, you do have one question.
Great. Why don't we go ahead and take it?
Very good. Caller, your line is open.
Hi, this is Sandy Magnan from Minnesota and now from North Carolina. Thank you so much for an extremely interesting presentation. My question is, was the experience of Montana out in the West similar to other states, or were there some unique characteristics or different characteristics to what happened in Montana in comparison to other states?
Well, thank you for the compliment, and so I'll try to jump in on that. So I think, Montana, there's a couple great books on the pandemic. So one is John Barry's book, The Great Influenza. The second is an older book by Alfred Crosby, The Forgotten Pandemic. And so Montana, let me think here. I think Montana had one of the highest mortality rates of all states during the pandemic period. I can't remember which states had it a little bit higher. But I think, let me think here. So we had a high mortality rate. I think part of the issue here was that maybe a little different from some other states was because of the labor and production and what was happening. So Montana now and as in 1918 is a major wheat producer. And northeast Montana in particular produces a ton of wheat. So folks were going crazy at that time period trying to plant and harvest as much wheat for the war effort. So there's a lot of mingling, a lot of public exposure during for transporting that. And then the other pieces were Butte, Montana, again, I'll just use that as an example. There's number of other cities here in Montana. It was the place where they were digging the hole in the earth to get the ore out of the ground for the war effort. And so lots of people coming in, lots of people coming out, so lots of opportunities to spread disease. And maybe I didn't hit on your specific questions.
This is Greg. I don't know if I feel confident answering that question because we haven't gone in depth as well as in some of the other states. But I think some of the aspects of Montana probably was unique to the idea of what Montana is, but you might be able to find spots like it in other cities or towns across the country. So as Todd talked about a lot with Butte and just the number of immigrants there and the type of work and the work was going towards the war, but a lot of the work that they were doing, a lot of the workers who were doing it might not have been for the war. I think that plays into it. And then the other side, Montana's the fourth largest state in the Union now. At that time, Alaska wasn't part of of the Union as a state, but it's a huge state to cover, and I think that's another issue. Not only the few public health workers that we had, but what area they were supposed to cover, which I think made things a little bit challenging, as it would be in some of the other Western states.
Yeah, and I'll just chime in on that one is, that image they had of the Model T car, the Red Cross volunteers going out to remote communities. So there were a number of documentation from both death records and newspaper stories where the teachers and the volunteers were going out and they find, because of isolation, unfortunately some local families got infected and the entire family were dead, either just from influenza, but also from starvation, from inability to cook and take care of themselves.
Mike, if we could just add one other thing in real quick.
Yeah, please. Please do.
We just wanted to highlight, there's 3 authors on the report. Todd is the, by far, lead author. He's done so much of the work. But another mentor of ours was the state health officer for Montana prior to me, and has worked in public health throughout his career, is Dr. Steve Helgerson, and he actually wrote a book on the whole thing called The Country Doctor and the Epidemic, which we just put up there too. It's a fun read. It's a historical fiction.
Yep.
So he's made up the doctor in the middle of it, who's the story, but the stories are all very congruent for what was going on at the time, and actually some of the members that we even mentioned in our talk, such as Janet Rankin and others, are mentioned in this book. Just wanted to give a plug for that.
Yeah, great. No, that's awesome. Thanks very much. Operator, any other questions this afternoon?
There are no other questions at this time.
Great. Well, thanks, Donna, for your question. And I certainly, really, again, looking at the top of the hour here, want to thank everybody. So this piece is published. Is that something we can find online and share? Your piece?
It'll be coming out in the publication will be coming out in the summer issue of the Montana Historical Society's journal. So I'll let you know.
Great. That'll be wonderful to share once it's published. So, again, thanks for your time today, and certainly for all your hard work telling this really important story. And it just shows, again, the deep roots public health agencies have across the country, and the way we respond to challenges of the past and think about challenges of the future. So I really appreciate you teeing this up in this 100th anniversary year, and certainly appreciate you being part of our National Public Health Week recognition. And so with that, I want to wish everybody a great afternoon, and thank you all for joining us. Talk to you all later. Many thanks for joining us. Talk to you all later. Many thanks for joining us. Talk to you all later. Many thanks for joining us. Talk to you all later. Many thanks.